Welcome to my YouTube channel. In this discussion, I'll focus on another important topic under leadership and management. And I should also emphasize that this may, of course, be biased towards the health sector, but it can also be used in other sectors of life. So we'll basically focus on introduction to supply chain management and pipeline. This is part one. Part two will be posted in the soonest. I would urge each one of you, as you go through these educative videos, I am, of course, urging you to click subscribe so that the channel grows and more things can be done on it. So this is part one. On the introductory part, I would like to, I think, stress that this topic usually will focus on how these goods which are used in the health sector, for example, essential medicine, ARV test kits, are delivered from the manufacturer up until this consumer, or in this context will be viewed as a customer, is given this product. So our Ministry of Health, of course, even other Ministry of Health, apart from Zambia, usually they have gone into engagement with cooperating partners. And for efficient management of these supplies, what has been adopted is known as the supply chain management. It's for a particular reason. This is just to help in tracking down the consumption, number one, of essential medicines. Then apart from that one, HIV test kits and the supply of antiretroviral drugs. Then these measures have ultimately ensured that the right commodities in their right quantities, in their rightful condition, are delivered to the right place at the right time, and of course at a cost that is effective, cost effective. Okay, so this, of course, I should also emphasize that the points from A, B, C, D up to F are also termed as the rights of logistics and management. Now, because of this, there is so much improvement in the availability of health commodities at the facilities, meaning at the health facilities, starting from the tertiary levels until the starting from the primary level cares until the tertiary levels. And ultimately, this has resulted in client satisfaction, because when you walk to this clinic, you definitely find these services. So this has helped a lot. Then just briefly, we also, I think, acquire knowledge, basic knowledge in supply chain management in this discussion. Then apart from that one, you also be able to define basic terminologies that are used in supply chain management and logistics management. Then apart from that one, you also be able to state the importance of logistics in health programs. Then, of course, this could be more emphasized in part two, but even this part will touch on the explaining the purposes of logistics system, and then outlining the logistics cycle will come in part two. Okay, now let's start with the definition of terms. The first definition of basic terms is supply chain management. Now, supply chain management encompasses the planning, that's the first thing, and management of all activities that are involved in sourcing, procurement, and of course, all matters that are related to logistics management. So this is supply chain management. From sourcing, where will we get these drugs? Okay, so it goes all through these particular important stages. Then apart from that one, it also includes the coordination and the collaboration with, of course, different partners along the supply chain. A very basic example that we can give, it's the distribution of the famous COVID vaccines. And this is where I think this is so much applied. Okay, we are seeing some of these drugs, some of these vaccines being supplied from supporting countries coming, for example, United States of America. Apart from the United States of America, I think we have also seen China, India is supporting the developing countries in terms of supply of these vaccines. So for these vaccines to be well used, utilized, this supply management is utilized as the maximum. So I think this is so critical. Then apart from that one, it's also important to take note that the other term, which is so important, it's logistics. Okay, now logistics simply is part of supply chain management that plans, that's the first thing, implements and controls the efficient, effective forward and reverse flow, of course, including the storage of goods, services, and related information between the point of origin and the point of consumption in order to meet customers' requirement. So this, I think, is also so critical for us to understand. Now, for us really to get the concept, we'll try to give an analog as we continue so that we understand well before we even apply it to the real life situations. Then apart from this, the other term that is so important for us to, I think, understand is the term commodity. So this is basically the supplies and the services. Then the other term is commodity security. And this is basically when every person is able to obtain and use quality essential health supplies whenever he or she needs them. If I walk into this facility, if I'm sick, I should find Panadol, for example, paracetamol, because the system is so well set up. But if we are seeing lapses, then there could be chances that individuals that are in the chain of supply may not be doing their correct work. Right. Now, on the other hand, commodity security in reproductive health exists when every person can be able to choose, obtain, and use quality contraceptive methods. Now, this cannot just be restricted to reproductive health. Even other services, I should be able to choose, okay? Should be able to choose, I want to access this service. And that particular time, I should find that service available. The other term is pipeline. Now, this is the entire chain which involves procurement of commodities, their storage, including the facilities that are being used to store, transportation up until they reach the end points. Now, what is the importance of logistics in health programs? Number one, it increases program impact. It increases program impact. How? If we have these supplies that are available and people are able to utilize them, that program will be so much effective. Then apart from that one, it also enhances the quality of care that is being given. So meaning well-supplied health programs can provide superior service and contrary to the poor supplied programs, which cannot perform as compared to the well-supplied programs. Okay. Then apart from this one, the third one, it also improves cost efficiency and effectiveness. Okay, an effective supply chain contributes to the improved cost effectiveness in all parts of the program, and it can stretch limited resources. So it improves cost efficiency. There is no wastage. Okay, there is no wastage, and because of this, the monies that are being used to purchase these supplies are utilized to its ultimate, meaning it also improves on the quality of services that are being provided. And of course, it strengthens and maintains the logistics system in an investment that pays off okay, in 3 areas. Number 1, reduces the overstock. Remember, you are able to document. It reduces, secondly, the wastage, okay, the expiry, the damage, the pufferage, and the inefficiency. So all these loopholes are taken care of when logistics management is taken up seriously. Then I think the other thing that we should also understand, it's a concept that we can use of a restaurant. In a restaurant, you would find that we have an individual who is a waiter. There's a kitchen probably, then we have waiters that are taking these goods and being given to customers. And of course, this is a perfect example of a logistics system to make things easier probably to understand. Now, in this context, the kitchen is a storage facility. The food is held there until it is delivered to the customer. The waiters will provide the transportation. They carry that plate of food to the one who has actually bought that food. Then the tables are the service delivery points where customers sit in order and eat that food. Okay, so this is actually giving us a perfect example of how these goods move from the storage facility, taken, transported until the consumer, who is the endpoint user, gets the preferred preferred goods. Now, our expectations, if I walked into such a restaurant, number 1, it should be attractive and pleasing, excellent customer service, and the order that I've placed should be available at all times. Then the food should be served promptly. So in a similar way, when you have walked into a facility, all these things should be well set, okay? In terms of attractiveness and pleasing, the facility should be clean, excellent customer service. I should not find people that are shouting at me. Then when I've ordered, for example, if I'm sick, I have malaria, I should find malaria drugs. Why? Because there is efficiency, okay? Then promptness, meaning whatever service I'm requesting, it should be given to me right there and then. Then the correct order should be delivered, of course. Food will be of acceptable quality, food will be of acceptable quantity, cost of the meal will be corresponding to the value. I cannot spend 100 kwacha or probably $10 on food that is not palatable. Okay, in a similar way, if the logistics chain supply is well set up, all these things should fall into play. In our next session, we will focus basically on the last components, but we'll start with the 7 rights of logistics. In other literature, it will be indicated 6, but of course there are 7. So 7 rights of logistics. Then apart from that one, we'll also focus on the cycle of logistics. So for now, it's goodbye, but of course, ensure that you subscribe to this channel, help this channel to grow so that you can receive as much information as you would be able to, of course, receive. So for now, we'll end here. In part 2, we'll try to focus on the 6 rights of logistics. That will be our starting point. So for now, we can end here, and it's thank you from my side. And thank you for your time you have spent on listening and watching this video.